As more and more programs transition to Construction Plus, we are working to adjust and be flexible in offering alternative service avenues that align with them. But we are compelled to make sure that member activity falls within the scope of our grant, so there will be some places where this doesn't fit.
We are going to be discussing community health and wellness as an AmeriCorps service track. When a program opts to add an extra career path, offering a certified nursing assistant or CNA certification is usually a really strong first choice because it's such an in-demand career field for navigating our young people too, and we're hearing that more and more from all of you in the field. But this can be a difficult one to get right for AmeriCorps, so that's what we're going to be talking about specifically. In order for any career pathway to make sense for AmeriCorps service, we have to build into the program design a good amount of service projects outside of the training that's required. And this is particularly important for this type of track. These service projects have to fill an unmet community need. They can't just be practical work hours that are tied to the earning of a particular certification that the members are working towards. So the important thing to understand right out of the gate here is that non-construction vocational tracks don't always automatically equate to a primary AmeriCorps service track. To do this, there has to be an identified unmet community need that members are going to be able to impact through their service. That's what needs to happen for a healthcare vocational track to work really well and become a community health and wellness AmeriCorps service track. So if you think of it this way, if YouthBuild AmeriCorps construction members are addressing the affordable housing crisis, what will community health and wellness members be addressing? So programs have the flexibility to choose what the need is and how members are going to be addressing it, and it could be a number of needs that you identify at your program. So again, the question we're asking here is there a value add to the community that's going to be a part of this new service track, and what is it? So I've thrown some examples up on the slide here. Some examples of an unmet community need could be obesity and providing healthy lifestyle choices, resources around that. It could be as simple as helping to navigate what can be a very confusing healthcare system, or general clinic support, patient education, providing resources for community members who otherwise wouldn't be able to access those resources. Or you could point to a specific community health topic that is important to the community that you're living in, like HIV or AIDS awareness. And these are just a few examples of community needs. Now, the other question to think about is, who are the beneficiaries of the service that your members are going to be working towards? We want to make sure that our members are going to be impacting underserved, low-income community residents who are most in need of our AmeriCorps members' time. Now, the last thing I want to point out here when we're talking about an unmet community need is that we are identifying a value add that is separate from the fact that our members are going to be earning credentials that will make them more employable. So that's a really important, vital outcome of any YouthBuild program, but in order to create an AmeriCorps service track with allowable service activities, we're really working to identify a community need, like the ones listed here, that members are going to help impact, that's separate from the fact that they're getting training that will help them get a better job. After identifying an unmet community need, it's also really helpful to plan out the impact that you're hoping this service will have on that community need. So here we're asking you to think about how the impact can be measured and how you will be able to report on an outcome for this track in the future. So I just wanted to give a few examples again to help make this clearer, specific to community health and wellness. So like on the last slide, if you had identified obesity and healthy lifestyle choices as a community need that you wanted to impact, then you could say something like this first bullet point: developing and providing educational workshops to children about healthy eating is one of the outcomes you're going to be working for. And then you could report to us the number of workshops that your members were able to develop. Similarly, if you had identified maybe navigating the healthcare system or patient education for low-income residents, you could talk about working with seniors to follow through with patient recovery plans. And then you would be able to tell us the number of low-income seniors that your members helped to serve. So you can start to see how we're building a strong narrative and a plan here with a community need or a set of needs, identified underserved beneficiaries, and set objectives to measure the impact that our members' service hours are going to have. And again, all of this being community focused, separate in some ways from all of those certifications and trainings and job placements that the members are working for. Another challenge in establishing a really successful community health and wellness track is identifying the right community partner where your members are going to be able to earn their service hours. So members must perform their service at a nonprofit or a community-based facility to designated service recipients. So again, as I mentioned earlier, we want to make sure that member service hours are impacting underserved, low-income community residents who are really in need of these volunteer hours. Community health and wellness as a primary AmeriCorps service track is not really an option if the YouthBuild students are only engaged in a certified nursing assistant or similar training program at a for-profit facility, such as a for-profit hospital or a for-profit nursing home. It's not the right fit for allowable service hours, and you may need to find a separate community partner that would allow for service hours to be earned towards impacting the community need that you identified. Again, keeping in mind that the right community partner must be a nonprofit or community-based facility. So the last priority I want to highlight in planning a successful community health and wellness track is making sure that the service projects you're planning allow for enough hours to actually complete an AmeriCorps service term. And with that, of course, the opportunity for successful completion and the members earning that really important education award. So what is important to think about here is this question: is there enough time built in for members to be successful? So in addition to all of their education, their training, their work towards these certifications, other program components that you might have going on at your site, is there enough time to allow for the number of service hours that they need? And similarly, are there enough service opportunities for you to schedule with your service partner, your community partner, that will add up to their hour goal? So a really helpful tool in helping with this is our program calendar tool. The purpose of that is to help you plan out the service hours to see if you can fit in enough into your typical program cycle length to help members be successful. And again, it's meant to count AmeriCorps service hours, not just tallying up the number of hours that members are engaged at your program. Because unfortunately, as we know, most of the time, most of the hours that members are with you at your program can't be counted towards earning their education award. And so that's what the program calendar tool is meant for, is for planning out service hours to make sure you have enough so that we know our members will be successful in this service track. What we thought we'd do next is call out a few examples from programs that are currently running a community health and wellness track that we thought might be helpful to share with the greater network to highlight a few best practices. I am lucky enough to work with a program right here in Massachusetts, YouthBuild Springfield. They've developed a really strong community health and wellness track, and what I want to specifically highlight from their work with this non-construction track is the community partnership that they've developed. So as I mentioned a few slides back, finding the right community partner is a really essential part in planning a successful community health and wellness service track. So YouthBuild Springfield has partnered with a large healthcare system here in Massachusetts called Bay State Health, which is a nonprofit healthcare system. And among many services and locations, they operate a community hospital that serves mostly low-income populations right in Springfield. So the nature of this being a nonprofit, and because of who they serve and their mission to provide quality health care to all residents, makes them an excellent partner for an AmeriCorps service track. Members volunteer at Bay State Health. They provide support to patients that hospital staff often don't have time for. So they help patients understand and navigate the healthcare system and the hospital system. They help to educate patients about other resources that the hospital provides, and therefore they improve the utilization of health services in the community that patients might not be aware of. And they also help to identify patients that may need help accessing other services, such as financial assistance, and they provide resources to address specific health concerns that might be going on in their community, but they also work to generally reduce any culture or language barriers to health care. So again, this is a really great community partner because it is a hospital. It's able to provide members with fantastic experience across many parts of their program. They can get that job shadow experience, observation, and training towards their certifications. But the nature of the hospital being a nonprofit hospital it allows them to also earn their AmeriCorps service hours while providing this additional patient support that nurses and doctors don't often have time for those patients most in need of other resources.
YouthBuild Philly, they've done a lot of really interesting work the last year, rethinking and reframing their early child development work and taking a unique angle on the typical healthcare service, a focus on patient companionship. These members will volunteer with nonprofit healthcare and daycare facilities in low-income, underserved areas. These facilities rely on the members to come and volunteer to provide much-needed companionship and nurturing to patients and children, because health professionals and child care professionals are typically too swamped with their duties to really provide individualized and extended companionship and comfort. So quality of life, health, and progression of improvement can be directly linked not only to specific medicine or care, but also to mental health and state of mind. The students get to practice compassion and empathy as they write letters for patients, play games with them, wait for test results. And then those that support the low-income child care centers, they learn how to support a child's developmental growth through activities and play. And sometimes, for the youngest of charges, this simply means being held and played with to stimulate their mind. These are just two great examples of an unmet community need that's over and above doing practical hours at a hospital. It's also a good reminder of why all this criminal history check is in place, because if your student's primary service is going to involve vulnerable populations like seniors and small children, it's of the utmost importance that they are properly cleared to do so. Another thing I wanted to mention, and it's a certification you might want to pursue for your healthcare members, New Directions YouthBuild is added to the typical CPR first aid training by certifying all students in the emergency treatment of overdoses through the proper use of Narcan spray. This training has proved life-saving. Kyle Kambarami, pictured here, was one of the 2 Poughkeepsie members recognized by local media for saving lives in the community with what they learned. So as you plan out industry-recognized certifications for community health and wellness, consider this training as one of them. It could tie really well into service projects that involve informing the community or young children about the dangers of drug abuse, but it could also save some lives as well.
Some last thoughts to close out with. We've talked about the importance of thinking through what is the unmet community need that you're going to be working towards, who are the beneficiaries of the member's service, what will the impact of their service be on that need, and also is there enough time in the track for the members to just earn the number of service hours that is required for them to be successful. One more thing that I want to make sure to talk about and that you need to think through is, could any of the service activities that you're planning for the service track be considered displacement? So AmeriCorps members cannot displace staff in any way while earning their service hours. This means they cannot serve in a role that would otherwise be occupied by a paid staff person. The most common example of this that comes up in a community health and wellness track are members who are asked to work at the front desk of a hospital or a clinic or answer the phones. Basically administrative tasks that would otherwise be managed by a paid staff person that our members are asked to do instead. And that's just one example of what displacement could look like. So it's something to think through as you're planning service activities with a community partner, and something to talk out with your portfolio manager if you have any questions or concerns about it. Developing these tracks takes a lot of planning because there is real risk involved. We've had investigations that have happened in our network specifically tied to non-construction tracks, and so we really need to make sure that across our network we're doing what we can to plan from the beginning that there are only allowable AmeriCorps service activities that are going to be happening for our members who are engaged in these tracks. So we're here to help and support you in this. As more and more of you are interested in pursuing community health and wellness, just engage with us to ask us all of the questions you have as you're planning.